Alfonso Cajero, A Journey into Finance History. Chapter 62, COVID-19 Pandemic, Economic Shutdown, 2020. Unprecedented global economic disruption due to health measures. January 2020 began like any other year, filled with hope and resolutions. People celebrated, businesses thrived, and the hum of daily life was uninterrupted. But in the city of Wuhan, China, whispers of a new illness began to circulate. Few paid attention to the initial reports of a strange pneumonia-like virus. It seemed distant, a problem for another place, another time. As weeks passed, the virus, now named COVID-19, began to spread beyond Wuhan's borders. News reports showed hospitals overflowing with patients, healthcare workers in hazmat suits, and lockdowns. The world watched in growing apprehension, but still, the thought persisted. It won't happen here. By February, COVID-19 had reached the shores of Europe and the United States. Italy was hit particularly hard, with images of empty streets, shuttered businesses, and overwhelmed medical facilities broadcasting globally. The gravity of the situation started to sink in. Governments scrambled to respond. Travel bans were instituted, flights canceled, and borders closed. The World Health Organization declared a global health emergency, urging nations to prepare for an unprecedented crisis. Yet the virus moved faster than the preparations. In March, the first cases were reported in New York City. Within days, the city transformed from a bustling metropolis to a ghost town. Offices closed, public spaces emptied, and the once lively streets grew eerily silent. Other cities soon followed, and the world found itself in an unfamiliar and frightening reality. The economy, reliant on the daily churn of human activity, began to falter. Stock markets plunged, businesses shuttered, and millions faced the grim prospect of unemployment. Governments around the world imposed strict measures, social distancing, mask mandates, and, most drastically, economic shutdowns. The shutdowns aimed to curb the virus's spread, but the economic consequences were immediate. Restaurants, theaters, gyms, and small businesses faced existential threats. Industries dependent on face-to-face interactions saw their revenues evaporate overnight. The ripple effect was felt across supply chains, impacting workers and companies globally. The economic shutdown of 2020 was unprecedented in its scale and impact. It wasn't just a financial crisis, it was a human one. Stories emerged of families struggling to make ends meet, of individuals facing eviction, and of communities grappling with the dual threat of health and economic devastation. Amidst the chaos, there were tales of resilience and innovation. Businesses adapted by shifting operations online. Communities came together to support one another, and essential workers stood on the front lines, keeping society's basic functions running. As the first wave of the virus peaked, it became clear that the world was not just dealing with a temporary disruption, but a long-term transformation. The economic shutdown of 2020 was a defining moment, revealing vulnerabilities in the global system and prompting a rethinking of how economies and societies operate. The story of the COVID-19 pandemic and the economic shutdown is one of unprecedented challenges and extraordinary responses. It is a story that continues to unfold, shaping the world in ways that will be felt for generations. In this tale, we explore the myriad facets of this historic event, delving into the personal, social, and economic impacts that reshaped our world. As the virus spread, the first shockwaves of the economic shutdown began to hit. In the early days of March 2020, small businesses were the canaries in the coal mine. Restaurants, bars, and cafes, dependent on daily foot traffic, faced an immediate decline in customers. Owners and employees watched in dismay as once bustling establishments emptied overnight. In the heart of Manhattan, Maria's Bistro had been a neighborhood favorite for over a decade. Maria, the owner, prided herself on the cozy atmosphere and homemade pasta that kept regulars coming back. But as news of the virus spread and fears grew, the once lively dining room became eerily silent. By mid-March, Maria had no choice but to close her doors indefinitely. Maria's story was not unique. Across the country, small business owners grappled with the harsh reality that the very measures meant to protect public health were crippling their livelihoods. Layoffs began in earnest, and unemployment claims surged to levels not seen since the Great Depression. The initial shock was profound, and the ripple effects were immediate. In the tech hubs of Silicon Valley, the impact was different but equally severe. Startups, often operating on thin margins and dependent on venture capital, found themselves in precarious positions. Investors, wary of the uncertain economic climate, pulled back funding, leaving many fledgling companies teetering on the brink of collapse. One such startup was a promising fintech company that had just launched its beta product. The team, passionate and driven, had worked tirelessly to bring their innovative solution to market. But as the pandemic's economic toll became apparent, their investors froze new funding. The company, once full of potential, was forced to lay off most of its staff and put operations on hold. Large corporations were not immune either. The travel industry was among the hardest hit, with airlines, hotels, and tourism-dependent businesses facing an existential crisis. Major airlines grounded their fleets, leading to furloughs and layoffs for thousands of employees. Hotels, from luxury chains to budget motels, saw occupancy rates plummet to single digits. John, a seasoned pilot for a major airline, found himself grounded for the first time in his career. The skies, once busy with planes crisscrossing the globe, were now mostly empty. John and his colleagues faced an uncertain future, with many wondering if they would ever return to the skies. As the first shockwaves of the economic shutdown reverberated, governments around the world scrambled to respond. Stimulus packages were announced, aimed at providing immediate relief to those most affected. In the United States, the CARES Act was passed, injecting trillions of dollars into the economy. Direct payments to individuals, enhanced unemployment benefits, and loans to small businesses were all part of the effort to stave off economic collapse. The CARES Act provided a lifeline for many, but the challenges were immense. The unprecedented scale of the shutdown meant that relief efforts were often delayed and bureaucratic. For individuals like Maria, the relief was welcome but insufficient to cover all her losses. For startups, the aid provided a temporary reprieve but did not solve the underlying funding issues. The economic shutdown also exposed and exacerbated existing inequalities. Low-wage workers, often in service industries, bore the brunt of the layoffs. Meanwhile, those who could work from home, typically in higher-paying jobs, were insulated from the immediate economic fallout. The digital divide became more apparent as millions of students and workers struggled to adapt to remote learning and work without reliable internet access. In communities across the globe, people came together to support one another. Mutual aid networks sprang up, delivering food and essentials to those in need. Local businesses pivoted to online models, offering delivery and takeout services. Innovators found new ways to connect and collaborate, leveraging technology to bridge the physical divide. As the initial shockwave settled, the world faced the sobering realization that this crisis was far from over. The economic shutdown was not a temporary disruption, but a prolonged and transformative event. The road to recovery would be long and fraught with challenges, requiring resilience, adaptation, and a reimagining of the future. While the economic impact of the shutdown was immediate and severe, the human cost was equally devastating. Families and individuals found themselves grappling with loss, uncertainty, and fear. The pandemic laid bare the fragility of the systems that many had taken for granted. In Los Angeles, the Ramirez family faced an unimaginable ordeal. Carlos Ramirez, a construction worker, was the sole breadwinner for his family of 4. When the construction sites shut down, Carlos lost his job. His wife, Elena, had been a homemaker, dedicating her time to raising their 2 young children. The sudden loss of income left the family in a precarious situation. Their savings dwindled quickly as they struggled to pay rent and put food on the table. The lines at food banks grew longer, and the Ramirezes found themselves relying on community resources for the first time. Carlos searched tirelessly for work, but with so many businesses closed or operating at reduced capacity, opportunities were scarce. Mental health crises also surged as people coped with isolation, anxiety, and grief. Support systems that relied on in-person interactions, such as therapy groups and community centers, were disrupted. For those already living with mental health conditions, the pandemic exacerbated their struggles. In Chicago, Emma, a college student, found herself battling severe depression. The abrupt transition to online classes, combined with the isolation from her friends and the uncertainty about her future, took a toll on her mental well-being. Her regular therapy sessions, now conducted via video calls, felt impersonal and inadequate. Emma's struggle mirrored that of many young people who found their lives upended and their support networks strained.